Angel. This is my certificate for practical assessment. Today we're going to be going through a health assessment exercise pre-screening with the client. Been out to the gym beforehand and notified all the other staff, and also been out and checked the equipment that we're going to be using today for any hazards or faults. And now I'm going to greet with my client. Hi Brody, how you going?
Good to you.
Thank you. How's your day been so far?
Yeah, pretty good.
That's good. Getting used to the cold weather?
Oh yeah, I enjoy the cold weather actually.
You do? Oh, that's good. Okay, so I see you filled out the pre-screening exercise tool here. Okay, we'll just go through that quickly. Don't experience any chest pains or shortness of breath during physical activity. No. Not taking any medication. No. No muscle joint or bone problems that can prevent most of physical activity. No. And I see your goal here is to gain muscle in all areas. Yeah, that's a good goal. So looking at like 3 months there, see some results. Yep. And what are you going to do to treat yourself when you've reached that goal?
Sure, really good about it.
Sure. It says here you do a bit of wakeboarding, maybe buy a new wakeboard or something like that.
Pretty good.
Yep. Okay, what we're going to go through today is we're going to go through and take your blood pressure, your pulse, your height and your weight. We're then going to go through some strength exercises, cardiovascular exercises and some stretching. Okay, so first we'll begin with taking your weight. I'll just get you to take your shoes and socks off please. Are you ready? Yeah, just get you to jump on the scales there. .6. That's good. And we'll just measure your height over here. Just get your back up straight against the wall. Head up straight. So 176 centimetres. Just you put your shoes and socks back on there. Yep, so while you're doing that, we'll get ready to take your blood pressure. Have you had your blood pressure taken before? Yep, that's good. So we'll just need to sit comfortably in that chair, just with your arm resting on the table there. You might need you to pull that sleeve up again. It's alright. Okay, so I'm just going to strap this band around your arm here. The arrow, fix that up there. I'm just going to put this scope into here so I can hear your heartbeat. You might feel a bit of tightness while I'm pumping this up, but that shouldn't be too long. Okay, that's 124 over 88, so that's pretty good. Okay, now we're just going to take the pulse, so I'm just going to feel for your pulse in. We'll time that for 15 seconds, and then we're going to time the blood. Okay, so 18, so that times 4 is 76. That's pretty good. so now what we're going to do today is first we're going to start with a fitness test. We're going to be doing the plank test first, and then we're going to go out and do some strength exercises. We'll be doing some chest, back and leg exercises. And then we're going to go through and do some cardio on the treadmill, followed by a high intensity cardio circuit, and finish with some stretches. Okay, so we'll head out to the gym now for our fitness test. What we're going to go through today is a fitness test. It's going to test your core stability and abdominal endurance. Okay, so have you done plank before? Yeah, well, I'll show you the correct technique first. So you're going to come down onto the ground, onto the stomach. You're going to bring your elbows in line with your shoulders there. You want to curl your toes up into a elbow plank. You want to keep your core engaged, keep your back straight, and hold for as long as you can. Okay, so if you'd like to just have a practice first, and then I'll begin to time you. So down on the ground, elbows in line with your shoulders. Curling those toes up. Remember to keep that back nice and straight, that's good. Okay, good. So begin to time you. When you're ready. Okay, so just remember to inhale and exhale. Keep that back nice and straight. That's good. Keep those abdominals engaged. Going good there. So the muscles you're working in this one are your rectus abdominis, your transverse abdominis, and the erectus spinae muscles of the lower back also assisting there. Coming up to 30 seconds now, Brody. Remember to keep breathing. You've got good technique there. That back's nice and straight. Coming up to 45 seconds now. You feeling that? Just remember to keep that neck in line with the back there. Coming up to a minute now. Keep breathing. Minute 10, contracting those abdominals, that's good. Minute 15, keep breathing. Minute 20, you make it a minute 30, can we? Keep holding. Minute 30 there. Just notice your knees are starting to slouch a bit. Keep that back up straight. Minute 40. Yep, that's great. You've got great technique there, Brody. Minute 53. We're going to make 2 minutes. Keep that core engaged. 2 minutes. Yep, 2 minutes and 7 seconds. That was great. How did you feel that one? That was good. Okay, I'll just write that down. Okay, so we'll come and test that plank again next time we come back and see how much longer you can hold for. Again. Okay, so now we're going to move on to some strength exercises. We're going to begin with some body weight push-ups first. Okay, have you done push-ups before? Yep. Okay, great. Okay, so first I'm just going to show you the correct technique of the push-up. So you want to come down to the ground, into an upper plank, so hands just outside shoulder width, keeping that back nice and straight, keeping that core engaged, and lower your chest to the ground, about 5 centimetres from the ground, and pushing back up. Don't have to lock your elbows in, coming up, back up, to elbows at 45-degree angle on the way down. So if you'd like to have a couple of practice, then we'll get you to do 10 reps. Just do 1 set today. So lowering that chest to the ground, pushing back up. Yep. Remember to exhale exhale on the concentric phase, the upper phase, inhaling downwards. Okay, perfect. 7, 8. Just don't lock those elbows in at the top, you want to keep them nice and soft. That's 12. 10. Okay, so the muscles worked in that one are your triceps, your pectoralis major, pectoralis minor, and your deltoids. So on the chest, shoulders as well. Yeah. Okay, now we're going to move on to some back exercises. We're going to be doing bent over barbell row today.
Yeah.
Okay, now we're going to do bent over barbell row. So first we're going to start with just the bar today, just to get the technique right. First I'll just show you a couple. First you want to start with feet shoulder width apart, hands just outside shoulder width apart. You want to have the bar underneath the hands. You soften those knees, leaving that back straight. So you want to stand up nice and tall, pull those shoulders back. You want to start with the bar just about knee. Bring the bar towards your floor, engaging those abdominals, and lowering back down. Bring that bar back up, really squeezing those shoulder blades together, and lowering back down. You don't want to be standing too far back or too far over. You want to have nice and straight back because you dig those glutes out. Okay, so we'll just have a couple first with the bar and we'll add some weight on there for you. So you have your knees about shoulder width apart, your feet about shoulder width apart, hands just outside shoulder width. Yep, pulling towards the floor. Really squeeze those shoulder blades, keeping those elbows in beside you. Yep. How does that feel? That looks pretty good to me. Yep.
Yeah.
So we want to have our feet shoulder width apart, hands just outside shoulder width. Yep. You want to lean over, sticking the glutes out. You want to imagine there's a cliff there, so you really want to lean over there. Lean over there. Yep. Pulling that bar towards your belly button. Yep. That's great. Just remember to keep breathing. Okay, good. Now we'll add some weight onto there. Okay, so we worked out earlier that you're comfortable with 2.5 on each end. Yeah. Okay, so it's going to do 10 reps here. So feet shoulder width apart, hands just outside, lowering that bar to the knees. Remember to imagine that cliff there, so you're leaning over a bit more. You want to pull that bar towards the abdominals, contracting. Squeezing those shoulder blades together when you're pulling back up and keeping those elbows to the side. Yep, that's a perfect technique there, Brody. Let's get you to do 4 more. Yep, that's good. Remember to keep breathing. And 1 more. Perfect. Okay, so the muscles working in that one are your latissimus dorsi, your trapezius, and your biceps and deltoids. Yep, and the joint movements are the shoulder, elbow, and knee movement. Yep, okay, so now what we're going to do is we're going to move on to some leg exercises. We're going to do some weighted walking lunges. Yep, have you done lunges before? Yep, okay, that's good. Okay, we'll move on to those ones now.
Yeah.
So we want to have our feet now in some weighted walking lunges. So you've done lunges before, which is good. So first I'm just going to show you the correct technique. So just everyday normal lunge. So you're going to bring one leg forward. You don't want to bend over too high. You want to keep that knee in line with the toes. Keep your back nice and straight. Bring the other leg forward. Just like that. Normal everyday stride. Okay, so we'll just get you to have a couple of practices at those ones. We're going to add some weight. Okay, so bringing one leg forward, keeping that knee in line with the toes. Yep, you're just sliding a little bit too far forward there, so just remember to try and keep that knee back. Yep, much better. Okay, good. Okay, so now we're going to add some lunges, some weights. Okay, so we've worked out earlier that you're comfortable using 3 kilos. So we'll just get you to use these ones. So you're going to have the legs down beside your body. Yep, so we'll bring one leg forward, keeping that knee in line with the toes, and just not quite touching the floor with that back knee. Remember to breathe. Yep, and we'll come back and do 4 more. Keeping that that back nice and straight. Really contracting those abdominals. Perfect. Yeah. Okay, so I noticed that your technique sort of started to slide towards the end there, so you just want to really focus on keeping that technique throughout the entire set. Okay, great. So now what we're going to do is we're going to move on to some cardio and hop onto the treadmill. Have you used the treadmill before? A long time ago? Okay. Just your basic treadmill here. So first I'm going to jump on and show you how to use it. So you want to enter the treadmill from the side, you never want to enter from the back. So just get your come over here. So here we've got our emergency stop button. It's always good to know about that one's there. We've got an emergency clip here, which I'll get you to wear. So basically we've got our speed, our incline button, and our quick start. So I'll just start with pressing quick start. We should start up. Yeah. So we've got our speed. So we want to bump our speed up to about 5.5. Just a nice walk there. Yeah. So we've got our handrails at the front here, handrails at the side. We can also put our hands on these ones and it will tell us what our heartbeat is at the moment. We've got several different programs we can do. There's fat burning, hill starts, cardio ones, use it to sprint as well. Yeah, so just press that emergency stop. And I'll get you to jump on. I'll give you a go on the treadmill. Okay, so yeah, just want to enter from the side. Just get you to put that click on there. Yeah. Yeah, just on your shirt there. Yeah, that's good. Okay, we'll start with quick start. Should start going in a moment. Sorry, just have to push that one back in when we've got the quick one. So we'll just quick start. We'll just bump that speed up to about 5.5. Going a nice walk there. Yeah. Okay, so yeah, pretty much what you want to know is you want to know where your emergency stop button is. Your speed, you can incline up or down on the machine. You've got your handrails at the front, handrails at the side. You've got these here to detect what your heart rate is. Put your hands on here. We'll just get you to bump that speed up a bit more, get you going a nice jog. About 9, maybe just 8. Yeah. Okay, so it's recommended about 3 to 5 cardio sessions a week, 20 to 60 minutes, but because your goal is to gain muscle, we'll focus more out in the gym with the weights. Probably get you doing 2 sessions a week to keep that fitness level up. How's that feeling?
Good.
Yeah. Okay, just get you to press the emergency stop when you're ready. So you're happy with that? And we'll go into all the programs and that more in depth later on, but that's just the standard use of the treadmill. Okay, great. So I'll let you catch your breath there and grab some water if you need. And then we're going to go through our high intensity cardio circuit next.
Yep.
Okay, so what we're going to do, we're going to do now is our high intensity cardio circuit. We're going to be doing 10 burpees, followed by 15 push-ups, followed by 8 hooks into a jump squat, repeated 6 times. We're going to get down onto the floor and do some bicycle runs, working the abdominals. Okay, so first I'm going to go through each one and show you the correct technique. So we'll start with burpees. This can be a very difficult exercise because mainly engages every muscle in the body, so you really want to get the right technique to get the most out of the exercise. So you want us to start, come down to the floor into an upper plank, pushing the tip of those feet out, keep that back nice and straight, bring those feet back in, and jump to the roof. So when you're jumping up, you don't want to lock your knees in, you want to come straight back down and repeat. So that's up, keeping those knees nice and soft. Okay? And then you're going to come down to do the push-ups. You've done the push-ups earlier, so just basically hands just outside shoulder width, back nice and straight, core contracted, lowering that chest just above the floor and pushing back up. Yeah, like that. So then you're going to go into 8 hooks with a jump squat in between, 6 times. So what we're going to do is we're going to soften those knees. We're going to punch 8 times. So you just want to imagine there's a bag there. Punching for 8 times. So I'm going to turn to the right and jump squat and repeat. 8 times back to the left. 8 punches for 6 times. You happy with that one? Okay, then we're going to come onto the floor for some bicycle runs. So we want to sit down on the floor in upright position. Heels on the floor, hands just beside your bicep, leaning back. You're going to bring those knees into your chest, working your abdominals. So I want you to go as hard and as fast as you can for 30 seconds. Okay?
No worries.
Can we just hold it for a second? Go through one of them each time, just to get the right technique. So we'll start with the burpee. Into an upper plank, bring those knees back in and jump. Yep. Perfect. Okay, down into a push-up now. Hands just outside shoulder width. Bring that chest to the floor and back up. Yep. Great technique for those ones. We're going to come into 8 hooks, so we'll soften those knees. Just into a little bit of a squat there. We're going to punch as hard as we can 8 times. Yep, and jumping into a jump squat. Down there and repeat it for 8 times. Yep, and we're going to do that 6 sets. 6 reps. Then we're going to come down onto the floor and work those abdominals. So you come down to the floor, sitting in an upright position, heels on the floor. Yep, so you just want to lean back, straightening out those arms. Yep, you're going to bring those knees in like you're riding a bike. Really contracting the abs. Okay, great. Okay, we're ready to, so we're going to do 10 burpees, followed by 15 push-ups, followed by 6 of the hooks and squats, and then down for 30 seconds with what we've done with bicycle runs. Okay, so when you're ready, I'll start timing you. You start your first burpee. So ready and remember to breathe. Keep that back nice and straight. Yeah, you're jumping up, not locking those knees in. We've got 4 more. 3 more, you can do it, you're doing great. Really contract that core. Yeah, now we're going to come down around 15 push-ups. Keeping those elbows at 45-degree angle. That's perfect. Keep that core contracted, back's nice and straight. We've got 5 more. 3, 2, 1. Coming back up into our 8 hooks. Jump squat between, so I want you to punch, imagine there's a bag there, you punch as hard as you can. Yep, squat jump to the left. Yep, squat jump back to the right. 3 more. Really engage that core, do all you've got. 2 more, Brody, you're doing great. And last one. Okay, great, straight down on the floor, work those abdominals, finish that off. We've got 30 seconds. Yep, and go. Really contract the abdominals, pulling those knees towards your chest, as fast, as hard as you can. Got 15 seconds, Brody. Yep, you're doing great. Keep going, keep going. 10 seconds. Really contract that core. 5 seconds. 3, 2, 1. Well done, that was awesome. Just let you grab a drink there and grab your breath.
Yep.
And then we'll go over and go through some stretching. So next time what we'll do is we'll go through that cardio circuit, probably go through it 3 times. We'll try and beat that time. Your time, by the way, was 1:48. Yep. So we'll write that down in your records and we'll go over that into that next time. Okay, great. Okay, now we're just going to go through some stretching. We're going to stretch out the quadriceps there. We're also going to stretch out the pectorals along the chest as well. So we're going to stretch out the quads. You might need something to hold onto if you can't hold your balance very well, or if you've got a good balance. So you just want to pull the same foot up, the same hand, pulling that towards your glutes, pulling that in, really stretching out those quads there, pushing that hip forward to feel that stretch more. Hold that stretch for about 20 seconds. Yep, you're feeling that stretch in the quads there. Yep. Switch to the other leg now for 20 seconds. Yep, you want to keep those knees in together. Pushing that hip out, really feel that stretch. Yep. Okay. Yep. stretch out these pectorals along the chest here. So what you want to do is you just want to grab the elbow just above the shoulder. Yep, really put the force into that bicep there, pushing, stretching out that chest area. Feel that stretch. Yep. If you find that you're not feeling that very much, you can always rise the elbow up to really open, stretch out those pectorals. Feeling that stretch in there? Yeah. Yeah. Feel good after those burpees? Yeah. Yeah. 20 seconds. Go to the other side. And so you can feel the force into that, pushing against that bicep. Stretching it. Yeah. So feeling good? Happy with that? Yeah. And well done. Wow, today was great. How did you enjoy today?
Yes, fun actually.
Yeah, that's good. Do you have any questions you'd like to ask me? No, you're happy with today?
Straightforward, yeah.
Yeah, so we'll be seeing you next time then?
Yep.
Okay, great. Thanks, Brody.
Okay.
Okay, for specific populations today, if my client were to have high blood pressure, which is pretty common, we'd want them to get a referral from a GP, just depending on the severity of it. We'd want to find out are they taking any medications. We don't want to make any sudden changes to their program, so no above the head, strenuous, abrupt movements. We want to allow a lot more rest between their sets. For their push-up exercise, for example, we wouldn't have them on the ground doing a bodyweight push-up, we'd have them on the wall, keeping the head elevated. And for lower back pain, which could be from a number of things, it could be spinal, it could be from work, it could be postural. A lot of people with bad posture can tend to get quite a bit of back pain. We want them to then get a referral from a doctor, or they can see an allied health professional like a chiropractor or physio. We can strengthen their abdominals. Sometimes people with weak abdominals can get back pain as well. And just with their exercising, instead of doing a sit-up, we can use a Swiss ball as well to take that strain away from the back.